Hi, my name is Robert Phillips. I'm going to be performing my 133 final assessment. I'm going to start off with the respiratory system. In the right lung, there are 3 lobes, the superior, middle, and inferior. In the left lung, there are only 2 lobes due to the heart, the superior and inferior. Now I'm going to oscillate her lung sounds and instruct the patient to take 1 deep breath in through her mouth and exhale. Deep breath in. In. Out. In. In. Out. In. Out. In. Out. In. Out. In. 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 Next, I'm going to be listening to the posterior lung sounds. I'm going to instruct the patient to take 1 deep breath in through her mouth and out for 1 full respiration. I'm going to use the diaphragm of my stethoscope to oscillate the lung sounds. Deep breath in, out, in, out, in, out, out, in, out, in, out, in, out, in, out, in, out, out, in, out, in, out. To listen for bronchovesicular lung sounds, you would listen between the first and second intercostal space of the anterior chest. To listen for vesicular lung sounds, you would listen at the third intercostal space at the base of the peripheral lung field. Next, I'm going to be performing my cardiovascular assessment. And the anatomical locations to oscillate the heart sounds include the apical, which is at the second intercostal space to the right of the sternum, the pulmonic, which is at the second intercostal space left of the sternum, Erb's point, which is at the third intercostal space left of the sternum, tricuspid, which is at the fourth intercostal space left of the sternum, and mitral, which is at the fifth intercostal space along the mid-clavicular line. And now I'm going to listen to each of these points using the diaphragm of my stethoscope. Next, I'm going to assess the patient's pedal, brachial, radial, and carotid pulse. Start off with the pedal. +2 equal bilaterally. Next, I'll do the radial. +2 equal bilaterally. Then I'll do the brachial. +2 equal bilaterally. And for the carotid, I'll do it 1 at a time so the patient can still breathe. +2. +2. Next, I'm going to check the patient's capillary refills. No beds are pink. Capillary refills is less than 3 seconds. Now I'm going to assess the patient's bilateral lower extremities. Extremity collars are consistent with race. It's warm, dry to the touch, and no edema is noted bilaterally. For my final assessment, I'll be performing a GI assessment. To perform a GI assessment, I will first assess, then oscillate, and then palpate the abdominal area. To assess the abdominal area, I will have the patient lay down flat as they are, drop down to eye level, and look for any distension. No distensions noted. Next, I will oscillate for bowel sounds. The sounds I could hear would be absent, which would be no sounds, hypo, anything less than 5 sounds per minute, normal, between 5 to 30 sounds per minute, and hyper, which would be anything more than 30 sounds per minute. To oscillate, I will start off in the right lower quadrant, then the right upper quadrant, to the left upper quadrant, and then to the left lower quadrant. Now, we'll take a listen. Patient's bowel sounds are normal, between 5 and 30 sounds per minute. And then lastly, I will palpate the abdominal area for any bulges or tenderness. No bulges noted, no tenderness noted. And that completes my 133 final assessment.